So you can get any kind of perspective you want from the internet. And so it's very important to be able to find resources that you can trust and know what you're hearing is what you need to hear. And sometimes you go get a second opinion and get a completely different opinion. We've seen that in some of the doctors. I think yesterday we had a nice little debate on tethered cord that went between a couple of doctors, and they both know what they're doing. So very good stuff. So there's a parent, a couple patients, several patients, caregivers, all represented on the dais here. So what we'll do is we'll just, I'm sorry, Barbara, you're going to have to start because we'll go this side to this side, and then just let them give a little bit of explanation who they are so that you can understand their perspective, and then we'll open it up to questions.
Okay. Good afternoon, everyone. My name is Barbara, and I'm a mom of Molly, who was diagnosed with Chiari malformation when she was 16 years old. And then subsequently, a couple years later, she was diagnosed with several other conditions that were associated with Chiari and Syringomyelia. And what I'd like to do in the next few minutes quickly is just give you a brief timeline from Molly's diagnosis to her current treatment, and then basically just pass on some experiences that may help you all in your journey in this world of Chiari and Syringomyelia, which is a pretty complex world, as we all know, in the last day or so from what we've heard. But Molly was diagnosed at age 16, and after a soccer injury that would not heal. And at that time, she was an extremely active athlete, and it was interesting to hear the lecture before about sports. She was a goalie, so she was bouncing around all over the place. So she was very active and very good, fairly healthy, but she did have some health problems when she was younger. She had constant headaches. She had a weird gait, strange way she walked, and she had vision issues. And we had her to some neurologists, and they said she had unspecified conditions, and there really wasn't anything. She was just a kid. So anyway, after she injured herself, a doctor said, well, I think you have an orthopedic problem, so let's have an MRI done and see what's going on in your neck and your shoulder. So we were very fortunate to have a radiologist that recognized that she had a Chiari malformation. And, that doesn't always happen because it's not that common, and some radiologists, they wouldn't recognize it. And I have to tell you a funny story because you have to laugh a little when you look back a little bit. A lot of you have had MRI studies done, and you never see the radiologist. That's the person behind the door, over there, and then you get this little report afterwards and whatever. Well, she was young, 16, so she's in the machine, and I'm sitting there, and all of a sudden, this little man comes running out. I didn't know who he was. I didn't know. He comes into the MRI room, and he says, your daughter has a Chiari malformation. And I'm looking at him like deer in headlights. I'm like, okay. And he said, we need to do some more studies, so your doctors can, treat her. And I didn't know what it was or anything. He just says, it's a rare condition. I said, fine, no problem. And in retrospect, looking back, I'm thinking, oh my gosh, this was just, the beginning of things to come with her. So anyway, to make a long story short about Molly's path, we were referred to a doctor who did Chiari surgeries. And I want to emphasize that. Notice I didn't say a Chiari expert. He did Chiari surgeries. And we started our journey down surgery lane, if you know what I mean. So anyway, Molly's had several decompressions, several fusions, several shunt surgeries, several eye surgeries, and many, many more. The good news is that she's 25 now. She's graduated from college in early childhood education. She's gotten a job as a pre-kindergarten teacher in Maryland, and we're so incredibly proud of her. And it's been a long road, but it's possible. So hopefully you'll get that message. The bad news is how many surgeries she had to have and how much suffering she had over the last 9 years. But, there's a possibility that we feel as a family, and who knows, but there's a possibility that if we would have done things a little differently and known a few other things that maybe it might just be a little bit better for her along that 9-year journey. So that's her journey. And now I'd like to, a few thoughts on the experiences that may help everybody if you have the condition or somebody in your family has the condition. First of all, find out as much as you can about the conditions and the related conditions, Chiari, Syringomyelia, etc. Read. Go to the internet. I know you have to take it with a grain of salt, but there's still a ton of information out there. Go to organizations such as ASAP that has a wealth of information about the conditions and what the research is going on, etc. And go see more than one doctor, and do not rush into things. We did that. And make sure you make an informed and educated decision concerning your condition or your family member's condition and the treatment. Okay? That's the basis of. And now I'm going to give you the number one thing, and I'll be done. The most important thing is to find a Chiari expert or center that understands Chiari, Syringomyelia, and the many related conditions. If you take anything away from what I say here, and all of us say here, I think that's the number one thing. Find somebody, a center or Chiari expert that understands not just Chiari and Syringo, but the other related conditions. Okay, now, that's fine, but how do you do it? Everybody is a little concerned about it. Well, there's two things that can help you, and you have to use a little common sense. First, find the center that treats Chiari and Syringomyelia, or the expert, and who also has access to doctors that understands the related conditions, such as Ehlers-Danlos, hydrocephalus, tethered cord, POTS, mast cell. There's many others, but find a center or expert that understands. It's a holistic approach to these conditions. You've heard the old saying that it takes a village to raise a child. Well, it takes an army of doctors to get a Chiari Syringomyelia patient through their life with these conditions. And the last thing is make sure the center or the physician that you see, make sure they've treated Chiari patients. It's pretty common sense. If you go to a mechanic that's fixed one car to fix your car, or would you go to one that fixed 100 cars? I mean, it's pretty natural. But anyway, and in closing, I just want to say, I'm not trying to frighten anybody. It's quite the contrary. Really, there's so much hope and help out there now, and all the research and the things that have taken place over the last few years. And there's hope for all of us in today's Chiari world. And you just have to be proactive in your care. And thank you very much.
Hello, everyone. My name is Rich. I am the secretary of the board of ASAP, and I am 54 years old, and I live in Philadelphia, suburban Philadelphia. I am somewhat different than a lot of the people here in that I was born with spina bifida, myelomeningocele, and fortunately or unfortunately, both kind of, I had a very fine surgeon when I was born, which in 1963, it was a much different world. So I was treated very successfully. I was born at the University of Pennsylvania Hospital, so I had the finest doctors you could have at that point in Philadelphia. Everything went well. I had other conditions, other problems related to the spina bifida with my legs, which I had to have surgery on a little bit later in my childhood. But for the most part, everything went well. I went to school normally. I played sports. I wasn't the best at sports, but I played sports. My intelligence, I was a little bit slow in school, but not majorly. And pretty much because of that, because everything went so well, I mean, from my childhood, I went to a pediatrician, and every checkup was fine. Everything was fine for years and years and years. And So I kind of got lax at thinking about, I didn't even really think about that I was born with spina bifida because everything had been so fine for so long, and I thought I had surgery, it was corrected, I'm all good. So I ended up going to college, graduating college, going to law school, graduated law school, everything was great. 9 months into my tenure as a lawyer, I'm headed back to my college to go to a wrestling match. I had been the manager of the wrestling team, so I was driving back to college to go to a wrestling match, and I'm within sight of my destination, and I hit this intersection that is badly configured, and I was a very reckless driver, and I went into the intersection without waiting as long as I should have, and bam, and I'm broadsided by a car that was going about 40 miles an hour, so I was hit pretty hard. But I walked away. My car was spun and didn't hit anything, and my car was totaled, and I walked away, and I'm fine. Nothing's wrong. Everything's great. A little while later, I at that point had not been a normal sexually functioning adult. Of course, I am a normal adult, and I had the normal sexual urges and everything that men have, and I had the normal functioning, other than I wasn't sexually active. So I lost my sexual function. I noticed that things were different, and I said, boy, that's weird. And I just, whatever, I wasn't sexually active, and it didn't really bother me at that point, so I just didn't do anything about it. So years go by. A couple of years later, I started, when I would sneeze, I would get this major pain in my chest. And I thought, what the heck is that? It feels like I was getting shot in my chest, this extreme pain every time I sneezed. So I ended up going to a orthopedic surgeon because I thought it was like a bone or a muscle. I don't know. So I went to an orthopedic doctor. He sent me for x-rays. Of course, the x-rays didn't show anything. So I kept on this same trajectory, and the pain with the sneezing continued. Eventually, I ended up being sent to a neurologist. The neurologist sent me for an MRI. I was like, what is an MRI? I had no idea what an MRI was, so I go for an MRI, and the MRI comes back, and I have Syringomyelia. And very shortly after that, I had a shunt put in, a jugular shunt for my spina bifida, and I also had at that point I had a ventricular peritoneal shunt. They didn't do ventricular jugular shunts anymore, so I had a ventricular peritoneal shunt to deal with the hydrocephalus which had reoccurred, and still there were issues. So I had 6 months later, I had a decompression surgery, and things were okay. That was in October of 1996, and I kind of waited a little bit, but then things weren't going as well as they should have, and I kind of was like freaking out. What do I do? And I went to the doctor that had done the 2 surgeries, and he said the only other option is to put a shunt into your syrinx, but I don't do that. I'm going to send you to a doctor at Children's Hospital. So I went to a doctor at Children's Hospital who put a shunt into my syrinx, which was in my case, it was not a good thing. I ended up having the symptoms continue. I've had weakening in my legs, which has gotten more severe. I later on lost a lot of sensation in a lot of parts of my body. I was not able to flex my feet, so I ended up having to use hand controls in my car. However, even though all that happened, I am now 30 years a practicing lawyer. I'm a public defender, and I represent kids in court. So I'm very grateful that I'm able to do this and to help people and to be able to basically live a relatively normal life. Now, Barbara was saying about part of her advice was see more than one doctor, don't rush. I doubly recommend that. I basically went to one doctor, got diagnosed, said, in my city, Penn's the best hospital. I didn't even look to see if there was something called ASAP. I didn't look to see if there were doctors in other cities, which of course there are. That would be my big advice is we have a big country and there's some awesome doctors here, and in almost every condition you can possibly have, there's an expert. So do not settle, do not just get the first advice and then settle for that. Try and get the best advice you can and go to the best person you can. Whether you have to take an airplane to get to that person, do it. The happy thing is that, as I said, I am relatively healthy at this point. Aside from having to use a cane here, I'm able to function. I'm able to do my job. Everybody understands that I have this condition. My brain works fine. Even though people, when they see me walking, think I have cerebral palsy and some kind of a brain disorder because I walk funny, I can get along pretty well. So, the advice would be when something is going wrong with your body, get to a doctor, and if that doctor doesn't know what's going on, get to another doctor and keep going to different doctors until you get to the person who knows what's going on. So that's pretty much, in terms of a Chiari, there's a lot more going on with Chiari, quote unquote, Chiari centers and places where there are experts in the different related fields to Syringomyelia and Chiari. So that's actually a good thing, and it's, I would certainly search that out in your city to see whether you can find one, and if not, go to another city and find one, because the more experts that you can find in your condition, the better off you will be. So, thank you.
Had to move it down. Okay, so I'm Annie Chapman. I am the treasurer for ASAP, and my journey took a real long time. It was almost 20 years before I had my diagnosis. I started having symptoms when I was in college. At least I started paying attention to. I have, all my symptoms are on the right side of my body. I started having just pain in my hand, limited to here. And through a very slow, gradual period of time, it moved up past my elbow. And because it took so long for my pain to move, and because it was something that I've always had, what I thought was normal, meaning living in pain, not sleeping, being clumsy, not having a good memory, dropping things, all the symptoms of a Chiari patient, I thought that was a normal thing. So I never questioned my symptoms and didn't really pursue it that much. When I went to a doctor about why did I have pain, they said, oh, well, what do you do for a living? Well, I'm an accountant. I work in an office. You have carpal tunnel. Okay. Were you ever in an accident? Yeah, I had a car accident. Well, you have a pinched nerve. I said, okay. And that was that. Once I really started having more balance issues, dropping things more, losing my train of thought, I thought, you know what, maybe this isn't so normal. And so then I started to really pursue and talk to a neurologist, And it took us a long time to do all the different testing to see what was going on with me. I finally got my diagnosis when I was 37. And they told me I had Syringomyelia, but they said, you don't have a Chiari. And I said, okay, well, I don't know what this is, but I looked it up. And my neurologist was not familiar with Syringomyelia. She admitted that she wasn't. And she said, you know what, I'm going to find you a surgeon, though, so that you can figure out and talk to someone who can, let you decide what you want to do. When I got to the surgeon, he told me, Annie, you do have a Chiari. And I said, oh, they said I didn't. Well, no, Annie, you do, and let me show it to you. So I had a Chiari, 8 millimeters. I had Syringomyelia, C5 to T5. 1 year after my diagnosis, I underwent my decompression surgery. 6 years after surgery, my syrinx did collapse a little bit. I still have it, but it's now from C7 to T5. But we knew going into it that it probably wouldn't go away. It's just there, and I've accepted that. My Chiari did go up, so I'm real happy with that piece of it. I feel I'm a success story. So that's just a little bit about my journey. It took a real long time. And I think a big part of it was I didn't know to question it. And that's one of the things that I've learned about this is really kind of listening to your body more, being your own advocate, and asking the questions and not doubting yourself. I found that I did that a lot. I think the biggest lesson that I learned was I'm not Superwoman. I'm a single mom. I have a really stressful career, and I thought I could do it all. And what happened to me after my surgery was I ended up having a really bad anxiety attack, and I was having breathing problems because I thought I could just get up and go after my surgery. And I wouldn't let people help me, and I was just trying to be a superwoman. And I've learned that, you know what, I'm not. I can't do everything. It's okay to ask for help. It's okay to say, no, I don't want to do this. I don't want to go out on this event. I want to stay home. I want to rest. I've learned to keep away negativity. I keep only people who are going to be positive in my life. I find that people who like to dwell on their illness, I try not to have them in my life. I've learned, and they were talking about this too, there's a difference between different types of surgeons. I did go to a really good surgeon in Houston, but I didn't know that there were people who, instead of doing, say, 20 surgeries a year, did 20 easily in a month. That's a big difference. If I had known better, I would have definitely gone out of Texas and gone to someone who made it their passion instead of just, oh, yes, I do Chiari. That's definitely something that I would have changed if I had known better. I don't take any medicine for the pain, and I live in pain. There's not a day that goes by that I'm not hurting. I can best explain my pain as fire going through my veins. That's what it feels like, 24/7. But I don't take any medication for the pain. I went through a period when I did try to take all those different pills, and I found that it just, the side effects were just not worth it to me. So I really loved what Dr. Green had to say this morning. I totally, I try to incorporate almost everything that he talked about. What I did, and I was always a physical person, but it really wasn't until my surgery that I said, you know what? I really need to change my body and the way I see things, and what I do. So I take a really holistic approach to the way I maintain myself and my pain. You know, I practice yoga. I find that helps my vestibular problems. It helps manage my pain. And we used to have someone, Dr. Lissert, who came and did a couple of presentations for us. And he talked about pain. And he actually said, and I thought it was really weird, but pain's in your head. And that you can actually control your pain. And I thought, no, you can't. But I found that you actually can through having a good, clear head. When you're really stressed, right? Oh, you're hurting real bad. So I find that I find ways to keep the stress out of my life. I've even changed jobs because that was a huge stressor on me. I've changed the way I eat. I have sleep apnea, so I've changed some of the way I do things at night before I go to sleep. Unfortunately, I didn't do a good enough job because I actually developed a heart murmur as a result of not getting my sleep under control. I still have the heart murmur, and it still gives me occasional issues. But that would be really my recommendation is to really push all the stress out of your life and really say yes to yourself.
Good afternoon. My name is Sarah, and I'm a Chiari patient, but I'm also an Ehlers-Danlos patient. So I come with the complexities of a whole lot of other conditions. And there's Ehlers-Danlos, dysautonomia, in my case, postural orthostatic tachycardia, mast cell, and some things that we're working on trying to figure out. I knew when I was 12 that there was something different about me. I couldn't run and keep up with my peers. I was constantly rolling my ankles and things like that. My family completely ignored me. My parents were of the type who said, "Oh, get up and keep going. You're fine. You can do it. You can do it." And everything. So I kept trying to run around and be a normal kid, and I found that I was a whole heck of a lot happier when I was reading a book and being quiet. I went away to boarding school at 14 through my own choice, by the way. It was my choice. And rode horses. Fell off quite a few, Dr. Kula. Sorry. While I was there, I was diagnosed with migraines, and I'd been having headaches forever, and they said, "You have migraines." I'd gone to a big university in the town fairly close to where I was, and they just said I had migraines. Okay. Tried pretty much every drug that they gave me at that time, and Imitrex was the big one that they tried, and it gave me rebound headaches, so I didn't continue with it and lived on Advil for probably 10 years. Realized it was really not doing me any favors, and there were a lot of other things that were going on, so I decided Advil was not worth it. I did not find out until my 40th birthday what was actually wrong with me. It was 1 week before I turned 40 when I was diagnosed with hypermobile Ehlers-Danlos. The subsequent diagnoses came later. I'm the first in my family to be diagnosed. I am most certainly not the only member of my family who has Ehlers-Danlos. That led me to going to the EDS conference that summer, where I met a few wonderful people, including someone who helped me learn how to advocate, especially for myself and also for others. I went to the local hospital and went to several neurologists. Nobody had an idea of what my headaches were caused by. Everybody said, oh, you're depressed. Oh, you have migraines. Oh, you have this. Oh, you have that. Let's throw some more medicine at you. And I literally had a medicine list this long, and doctors were just throwing pills at me. I now keep that medicine list on a wonderful word sheet where I say all the things that I've tried that don't work and all the things that I'm allergic to and also don't work. It actually has made my life a whole lot easier, because now I can look at it and I can say to a doctor, no, I'm sorry, I can't take that drug. It gives me hallucinations or something like that. Chiari was something that nobody discussed until I went to two neurosurgeons in my local hometown, and one of them said, you have, which came first, the headache or the depression? And I said, excuse me? And my mom was with me, and she looked at him and she goes, do you know how many times my daughter has been called a hypochondriac or or depressed or things like that? And my mom actually for the first time realized that this was a bigger problem than we were able to deal with. So I sent my imaging off to 3 different neurosurgeons, all out of state. And one of them wrote me back and said, I'm sorry, you're not a candidate. And I said, okay, thank you very much. He'd just done surgery on somebody I knew, and I said, okay. And the other 2 said, we'd be interested in seeing you. I went to, I saw both of them, got opinions from both of them. The first one, I didn't see the second one until much closer to my actual surgery, but the first one said, you have Chiari, but it's about 3 to 4 millimeters, and your symptoms aren't that bad right now, so we're gonna wait. And I said, great, at least I know what's wrong with me. I'm not crazy. So I went, that was in February of 2016, and in August I sent him a message and I said, my symptoms are getting worse and I would like to come and talk to you. And so we ran some more imaging, did a video chat, and he wanted me to have try traction, try a neck brace, try all of that. So I did that, even did invasive cervical traction, which was the best thing I'd ever done in my life, and I was crying when he took the pressure off. So then I went literally the next day and had a conference with the other neurosurgeon who my mother met me at, and he said, you need O to C2 fusion and a decompression. You have a mild Chiari, but your symptoms are quite strong for a mild Chiari, and we would like to, we would do a decompression. And it was the first time that my mother actually really realized that my symptoms were not completely in my head, and that I was not making this up. And no, I couldn't just go get a job because my migraines were too out of control. So fast forward to December 2016, I was fused from skull to C2 and decompressed. I am a challenge to my neurosurgeon because he found something during my fusion and decompression that he calls dural blebs, which basically means that the bone is very thin and I have little tiny pinpoint-sized CSF leaks. He patched 12 of them, I believe, where he did the decompression, but as he said, he was not willing to open me up and see if there were more. My fusion and decompression saved me from being a bobblehead. I would do it again tomorrow. It really made a humongous difference in my life. The neurosurgeon I went to also understood all of my other conditions, mast cell, POTS, all of that. And the only problem we had was that I have a hard time metabolizing drugs. So getting my pain under control took a while. I still have headaches. I still have extremely bad headaches. We're talking, I live on a 7 to 9 pain scale. Most people who look at me don't believe me. And I sit there and I say, okay. My neurosurgeon and the team who works with him fully believe me and have done ICP or an ICP bolt on me, which was a little unusual. It was +7 to -7, so not quite a leak. And then they did tethered cord and another surgery as well. I'm 13 weeks out of those 2 surgeries, and I've had 4 great weeks. After all 3 of my surgeries, I had 4 great weeks of headache-free. They came back, so now I get some more testing, and my neurologist and neurosurgeon and my mast cell doctor all work together to try to figure out what is causing my headaches. So I'm going to completely agree on the theory of you have to talk to more than one doctor. I see on the pages that I'm on and the groups that I am part of, people who go to their local neurosurgeon and they say, you have a Chiari, and they have that surgery without knowing that they might have complications. So they end up having major complications because the possibility of EDS was not taken into consideration. Well, if you have EDS and you have neurosurgery, it provides a big problem, and you need to know about it beforehand. Doctors, you treat it a little differently than you do a non-EDS patient. Having multiple opinions was the best thing I could ever have done. Yes, 2 of them made me go home and cry, but the ones who didn't made me go, somebody's there for me, somebody's looking after me, somebody's got me. And my neurosurgeon doesn't give up on me. I can email him at 2 o'clock in the morning and say, oh dear heavens, this is getting worse, and I'll copy 3 or 4 doctors on it because I know that they all need to know what's going on. And he'll write me back, sometimes at 6 a.m. and saying, okay, we need to do XYZ test. When are you going to be in New York next? Or when are you going to be in this city next time so that you can get this done? I have a great team of doctors who work together. It is the best thing in my life. Challenge is they don't all live in my town, so I travel a lot. But I have a neurosurgeon, 2 different neurologists, because one deals with one thing and one deals with another. I have a mast cell doctor. I go to Blair Grubb for dysautonomia, who's one of the top specialists in his field. And I have a bunch of other people who follow me and look at me and go, okay, you're a challenge. But I'm learning to have fun with that and learning that I'm going to probably be a trailblazer in the fact that they don't know exactly what is going on with me, and that hopefully these dural blebs and the other conditions that I'm diagnosed with may lead to new genetic information for some doctors, may lead other doctors to notice dural blebs, because something tells me they're not as rare as I've been told. I was one of 12 patients to have them in a career of hundreds of neurosurgeries. And again, do not go to a neurosurgeon who says they do Chiari or Syringomyelia or any of those conditions, and they do 20 a year, because you need to go to somebody who literally specializes in it. So anyway, that's my story. I hope it helps.
Testing.
Cuff.
I'm going to make this a little bit more informal. I'm not a very formal person. I'm actually not really good at speeches, but I guess people at my university thought I was because they always chose me to be the speaker for the group. First of all, please give them a round of applause. I mean, holy crap. I was genuinely surprised when I came to this convention. This is my first time, and I can't believe how many strong people there are out there, and how I'm so surprised to see that there's other people out there like my mom, and it's weird. I'm Stevie Collier. I'm 26 years old. I am a neurosurgeon and a rocket scientist. Why'd you laugh? It could happen. It could happen. No. Is it the hair? Is it that I'm in tight jeans? I think his eyes got so wide. Yeah. Oh, I love Doctor Strange. I love Doctor Strange. No, I'm actually the opposite of anything medical. I am a high epic fantasy author, so I write about dragons, elves, orcs, all that good stuff. Thanks to my mom, and we'll get to that in a second. First of all, I'm not a caretaker. I laughed when my mom called me that and said, "Oh, you're going to this meeting for caretakers." I'm like, what? I'm not a caretaker. Caretaker sounds like I'm taking care of some person without a life, or I'm getting paid to do it. I'm not a caretaker. I'm a son. I'm a son. I've never known anything else besides Chiari and Syringomyelia. I grew up with a mom who could never do anything. She was always physically challenged. She had chronic back problems ever since I was born. And I've told a few people in the audience this, that when I was in elementary school, we went to some water park and I saw a girl jump out of the back of the truck. I was like, what just happened? How the heck did she do that? I had no idea women could do that. And to this day, I had no idea. And actually, I didn't even know men could get this. I had no idea. I just thought all women couldn't move. And so when I grew up treating women like delicate glass pieces of art, and I grew up sympathetic. I grew up patient. I grew up strong. I grew up extremely positive, and I grew up stubbornly proactive. And I say stubbornly proactive. That's my word that I created and my brother and I use, because things are going to go wrong, and they're going to go wrong sometimes. Just like I've heard so many times today, people go to these neurosurgeons who don't know. They didn't like. My favorite one was when one doctor called it a chimera, and I was like, "You mean Chiari?" She doesn't have a mythical beast in the back of her head, I promise you. So that was my favorite. So when I say stubbornly proactive, and when something goes wrong, you don't stop. You keep going. You keep looking for other people. You keep using the law of attraction. You keep positive, and you keep just believing that someone's going to be there and someone's going to help you. Like this, I didn't even know this existed. And my mom's mood has just been through the roof. Like her energy levels, it's been amazing. So I'm so happy to be here. Who here has one of these issues? Well, I'm not going to raise my hand, but how was your morning? Was it a hellish nightmare to wake up? It's terrible, and I know these mornings are terrible. So I'm wondering, like, if this is like for, Chiari and stuff like that, why do they have all these things scheduled in the morning? Because when I go to wake my mom up, it's like I'm awakening a mummy, pressing on her back, like, all right, let's get this leg working here and get that. That's what I do every morning. My brother, my dad, we all do the same. So it's not just me. So it's like awakening this mummy every morning. I've had to make a lot of sacrifices that I didn't even know I was making until I was asked to do this speech, which I really didn't want to do because I felt like I wasn't going to give any value. And if you're listening and you're thinking, I'm not giving any value, I'm sorry. I didn't really know. And I was going to tell the person who asked me, no, I don't want to do this. But my mom took me by the hands and said, you never know. Maybe there's a sentence that you have that will help somebody out there. And I started writing a list. I'll write 5 things that might help somebody. And it just kept coming and coming and coming. So I'm going to do this. One of the big sacrifices I made was, and these aren't huge sacrifices. I'm 26. I've had a very normal life. Went through private school all my life and graduated with French and business. So very normal. But I had a girlfriend for 6 years, and I moved in with her. And one day we got in a fight, and she told me, French is an ugly language. I was like, okay, whatever, okay. You don't clean the house right, okay. You spend too much time with your mom. You talk about your mom too much. I'm tired of you going to the other states to go to her surgeries. And then she called her a word that I don't even use, and I cuss sometimes. So I've been single for a year. Another thing we had to do, we were in Italy. My mom, thanks to my mom, I traveled to France and lived there, and she came too. I don't want her to be gone. I want her to, enjoy France. We got to the Tower of Pisa, and we found out we could climb it. And, we're paying our thing, and I'm like, well, I'm telling my brother, we can't get up there. She can't. And so my mom's like, no, sit back here. And I was like, I'm gonna climb those damn stairs. You gotta pay money to climb stairs. I ain't doing that. And when I thought about sacrifices that I had to make, I never thought about it. I never thought about these sacrifices. They just came naturally. And these were the ones I had to rack my brain to get. So the first thing I want to talk about, it's an uphill battle. And as the caregiver, or as I like to say, if you're the spouse, you're the father, the grandparent, the cousin, whoever you are, you just gotta make sure they're never alone. Make sure they always know that they're never alone. Surround them with the most important people in the world, their loved ones, high quality people. And if there's ever somebody negative in this circle, kick them out. Seriously, just kick them out. They're not needed. And if for some reason you can, if it's a family member, as Bob Proctor says, go less often and stay less. So that's a big thing too. If it starts to get worse, constantly modify. The past 2 years with my mom, it's gotten a little bit worse, and so we've introduced the wheelchair, which I have fun with, because she doesn't like wheelies, but I do. So we constantly modify, and if I get a little emotional, I'm sorry. So I'm big into the law of attraction. I'm big into meditation. I'm big into goal setting, and I also want to talk about individuality for people, caretakers. In my opinion, thoughts become reality. So if you're just constantly negative all the time, it's just going to get worse and worse and worse, and you're going to, just spiral downhill. And these are the people who don't get better or don't feel better. And I understand that. My mom always, when she's having a bad day, she's like, "Don't throw that law of attraction crap in my face right now." And I don't. But as a person who's with them all the time, you got to remind them to stay positive, even though you're the one getting frustrated and you're the one that this person's yelling at because they're in so much pain. Like, if you're out and about and you're out of this convention and someone says, "Oh man, I got a crick on my back," you don't know what back pain is. That's how it is with my mom. So for the caretaker, if you have frustration, meditate. There's a lot of free guided meditations on YouTube that I use all the time. I do it 15 minutes in the morning and 15 minutes at night. And remember that you're an individual. This has helped me a lot too, is to remember that I'm an individual. And for some reason, I always thought I'm married to my mom or something. And it's not that way. And I can't really explain this very well, but for me, it felt better just to say, I am an individual. I am my own person. I do need to go off and do my own things sometimes. I hope that helps somebody. And I always felt guilt, like I gave her this problem. I don't know if anybody else felt that way, but never feel any guilt for it, and just try the best you can to just show them love and so much. Just shower them with love, vomit love onto them. And set goals for your life. Don't let this become your main thing, I guess, unless this is your spouse. I don't know, I'm not married. I don't know how that works. Just keep moving forward, and they're gonna, if they love you, they're gonna push you forward as well. And a big thing is donate, give, tithe. A lot of people forget to tithe, especially people my age. They don't give. So it's just something new for me. I never believed in it myself. I thought it was stupid. But I started tithing, and it feels wonderful. Like, it feels so good. It's like giving a really good gift on Christmas, you know? And you're just like, oh, they're excited for them to open the Christmas gift. That's what it feels like. Here's something a little bit more practical. These are fun things you can do, things to look forward to. We do this all the time with my family. These are things that people with SM can do, Chiari, at least some of these, and that is travel. Make preparations, you know, use wheelchairs, bring cushioned seats, stuff like that. I mean, prepare for it. Putt-putt golf, mini golf. You can get a cane stool that turns into a chair that we use all the time, so when she's done putting, she sits down, boom. Movies with, you know, your little, you know, nice comfy chair. Family dinners, road trips, sightseeing, museums, theaters. That's a crap load of stuff right there. I gotta watch. I think there's a kid in here, so I gotta watch it. I told you guys I'm really informal. Here's some quick tips from a person who's known nothing else but these chronic back problems. So this is stuff that my brother and I and my dad do every day. A big thing is stay in shape. If you're somebody who is caring for this person, it's kind of irresponsible if you're out of shape, because what if something goes wrong and you need to be the strong one? And this has happened. This is a tough story, but my mom, her last surgery went terribly wrong. She got a screw thread into her spine, which I didn't know could hurt somebody so bad. It's a thread of a needle. When they told me, they had to tell me a few times, like, just a thread? It was 2 o'clock in the morning. 6 hours after surgery, and I was writing, and my mom raises out of bed like Frankenstein, screaming. And if you've ever seen Saving Private Ryan, it was like the people on the beaches with their legs cut off or blown off, and that's what it was like. And she just had spinal surgery 6 hours earlier, and she's trying to get out of bed. So I'm screaming, I'm running out, I'm terrified, I'm about to crap my pants. Like, I thought my mom was dying. And my brother and my dad were getting snacks or whatever, and I called the nurses in. They called this doctor in for an emergency surgery at 3 o'clock in the morning, and that's when they found out that they had the screw stuck in the spine or whatever. And ever since then, they told her, you're not going to walk again. You're just not going to walk. And I was like, that's bullshit. I tell her that all the time, you know, you're going to walk? That's stupid. What? You're going to walk? You're going to walk all the time. And, you know, we'll be sitting there watching TV, and I'll just be using my foot to lift her foot. And I'm like, this is how it's going to feel. Well, she's walking. And she's walking. And that's when I was like, the law of attraction really works. Thoughts become, you know, reality. I mean, there were other doctors that said she was going to walk, so that helped too. But it was me. It was me. Me and my brother, we don't take her crap, though. Like, if she's being down on herself, I'm like, snap out of it. You're fine. If she doesn't want to go anywhere, I love the wheelchair because we can just stick her in there and she can't do nothing about it. We're stronger than her, so we just push her anyway. Open every single door for her. That's how I learned to open doors for women. You know, it's simple things like that. Doors can be heavy for these the people with these problems. When walking uphill, press on their back. This is a big thing. Any amount. So my mom, it's in her thoracic, but for some reason, if I just push on the lower back, it works so much better for her. Try it. It works very well. Toilet cushions. So I call them toilet cushions. They're probably not called toilet cushions, but they look like toilet seats, but they're really soft, and your like spine goes in. I guess it's for help people pooping. I don't know what it's for. I don't know. I'm a fantasy author. I don't spend a lot of time in hospitals or whatever. Toilet cushions, get one. The seated cane, best device ever created. Make appointments for later in the day. Mornings suck. I actually wake up later now because my whole family does, because we revolve around my mom waking up. I'm guessing everybody here has very bad mornings, so make your appointments later in the day. It just makes for a better day. Take cushions everywhere. Don't get lazy. Take the cushions because you're probably going to end up sitting in a hard chair or one of these, the chairs of doom. My mom's not here right now. Well, I asked my mom not to be here for a reason. That's because I didn't want to be filtered. I don't want her to know this stuff that I do. I just do it. I don't know if that makes sense, but I didn't want her to know about it. And there's another thing. So I speak French because I wanted to take my mom to France and live there. And then she told me she wanted to live in Italy. So now I'm learning Italian. And a year and a half ago, she goes, you know what would be great? Let's just go to Japan. Just live in Japan. Nihongo benkyou shimasu. So I've been studying Japanese. I just pray she doesn't say she wants to live in Hong Kong or Iceland or anything like that. So hold all objects forward, no matter how small. I'm big on holding your purse. My whole family, we carry a purse. Pick up everything that they drop, no matter if it's just something like this. That's a huge freaking deal. I'll be across like from here to that guy over there, and if she drops something, I'm sprinting for it because I know she's strong-willed. She's going for it. I'm like, don't you do it, don't you do it. And she won't use one of those claw things because I called her a pirate once, and that was a bad idea. So she won't use it anymore. Make jokes. Make a lot of jokes. My mom tends to fall a lot. Y'all are gonna think I'm terrible. But we have a crude sense of humor in my family, but she'll go like this. I'll be like, oh, you're trying to dance? You're trying to get jiggy with it? And it always just turns it around from I'm debilitated to my son's gonna dance with me. That's what I do. I know it sounds crude at first, but watch a lot of comedy movies, and don't take that you don't have pain for granted. That's something else that my mom taught me. Like, every day I thank God that I'm able to do the stuff that I do. I'm extremely athletic. I'm a surfer. I lift a lot of weights, although they're modified because I'm afraid for my back. I'm smart about it. And I didn't want to be at this convention today. In fact, I thought it was a stupid idea. I told my mom that. I was like, this is dumb. You're going to go, and there's going to be nothing but whiners and complainers. I was so wrong. You guys are some of the most strong people I've ever met, and I'm so excited and happy and proud to be up here talking, and I hope something that I said today helped you guys, and if you have any questions, you can ask me. I want to finish off with authors that I've read that you should too. These have helped me stay strong, and there's a lot, so I'll just say them, and if you want to get with me after, we can talk about them because I'm really into success principles and stuff like that. So Jack Canfield, Tony Robbins, Napoleon Hill, Jen Sincero, Bob Proctor, Dr. Wayne Dyer, Esther Hicks, Robert Collier, Dale Carnegie, and Earl Nightingale. Guys, thank you so much for letting me do this. I wish you all the best of luck, and I'll be here next year. So, thank you.
Wonderful. Thank you, panel. Now, let's open it up to questions. If anybody has any questions, just raise your hand, and we'll come around. Here we go.
I want to tell him that you are a caretaker. You love and care about your mom.
Oh, yeah.
And that's beautiful.
That was just something to spice up the speech with.
Anybody? Any other questions? Oh. Yeah.
You guys have all talked about the need to get multiple opinions. Can you guys speak about how you go about it and what resources you feel like you have, and maybe what resources we as a physician community could provide you to make it easier and to make the process less painful to get these opinions?
Okay, I guess I'm going to go for it. For me, a big part of it was I'm not a huge fan of some of these groups, but a big part of it was Facebook groups. Beyond the Measurement is one that deals with Chiari and some of their things. A lot of these groups keep doctor lists. They do not, as a rule, allow doctor bashing. So there's very little. There is some, but there is very little bad talk about doctors. But for me, it was Facebook, it was word of mouth, it was talking to people in my local community who had had surgeries by people out of town, because I happen to live in a city where a neurosurgeon had done some really bad things, and people were extremely wary of doing surgeries. So it was a lot of research. I did not probably check many doctors' websites terribly much. For some reason, those, I mean, you look at, like, for example, your biography on Weill Cornell. It doesn't exactly say a whole lot about you. It doesn't, it's not giving you a whole lot of feedback about, what people, think. Whereas if you go on a site like Facebook and you say, okay, what is Dr. Greenfield like as a surgeon? And you get, he did my daughter's surgery, he did my surgery, he did this, he did that, and people, you get people's opinions. Yes, you do get people who say he wasn't a surgeon for me. And I've run into that. I've said that about surgeons, because they might be wonderful surgeons, but they weren't the surgeon for me. And I do not practice negativity at all online. I think that being positive and trying to be a leader is the better way of showing things like that. So I try to practice positivity about everything I can, and especially about doctors, because frankly, there are not enough Chiari specialists in this country who understand the extreme complexities of Chiari, Syringomyelia, especially when you throw in Ehlers-Danlos, POTS, MAST, et cetera. And so I did a lot of research. And Annie, any?
I do a lot of support group help for ASAP, and I really don't have anything to say about like how you would go about finding out, because I struggle with that myself, or I did. But what I hear a lot from the people who reach out to me is not necessarily finding a good surgeon, but finding a good neurologist. That's the biggest challenge that I think we as a community that I hear, and we have the hardest time finding a neurologist, because they're the ones who really help us after the surgery. Finding a neurologist who understands the condition, that is really the hardest thing, and I would love help on that.
Also, pain management, same thing. Finding a pain management doctor is like gold dust in certain places, because they look at you and they're like, I'm sorry, I'm just going to throw drugs at you and see if they stick.
Right.
They don't stick for me, so I'm on no opioids and no pain medicines.
I'd like to just turn this around a little bit, I'm sorry. But, it would be wonderful. Here we are, we're all patients or family members. If there'd be an unbiased group of physicians through some organization that could really sit down and define X criteria so that we really know who Chiari experts and Chiari centers are, and that, you all would define those criteria, what an expert is. Done X number of surgeries, that's an easy one. I don't know what they all are, but things that would be valuable, so somebody that's come into the community and has been diagnosed can go look at something and say, well, this group of doctors, and they're from all over the country, this would take a lot of work, but this group of doctors says this about all these different, these are the criteria you look at when you evaluate. And it would be so helpful because everything is so scattered. And I don't know what to say. It's a struggle. So if there would be some benchmark set forth by the people that are, that are doing the surgeries, in an unbiased way to help patients make a decision, it would be very helpful.
One other thing to keep in mind, I was diagnosed way back in '98. My very first surgery was from somebody I found out later was a vascular neurosurgeon. I was just told, you have Chiari, you need surgery now, and a week later I was in surgery. I had a huge CSF leak, and he told me I was a drug addict, go home, I fixed you. And so for months I suffered. Eventually I did research, and I was very blessed that my parents were financially able and willing to send me around the country. I saw 4 of the top Chiari experts, and I will tell you, every single one of them recommended a different course of action. So even amongst the top experts, and I'm saying I did all my research, I spent a lot of time, and these are guys that I've seen at conferences over the years, and I still know, and many of you would all recognize their names, and I have highest respect for all of them. It still comes down to, who do you have the best rapport with? Who do you feel the most comfortable with? What rings true to you, in my opinion?
Exactly.
Barbara, thank you for saying what you just did, because
Wasn't very eloquent, but
no,
I tried.
but you sort of hatched my one of my evil plot for one of the reasons why I put this together, because this was an item of discussion that we had on one of the board of directors calls a few months ago, whether ASAP should actually be involved in that. And there's some issues that involve, but definitely it seems that that's the way that we ought to go, that have some sort of guidelines for what is a Chiari center, and that's kind of why I put this together, to bring this topic up at the meeting. But I also want to give a word of caution. One of the things that I heard was, it's true, if you're one of the elements that you want to look for in a Chiari surgeon is someone who does a lot of Chiari cases. However, I think Jeff would agree, if I did 20 Chiari decompressions on kids a month, I would definitely need to be operating on kids who don't need an operation. So certainly you don't want to go to somebody who sees very few, but you also need to be aware that there's no magic number. And I think what you had said really rings true is, and when I tell my patients, you need to trust me. If you need to see every expert in the country to feel that you can trust me to operate, then that's what you need to do. If you can't trust me, then I'm not the right surgeon for you. So that element, that trust, that whether it's a sixth sense or whatever it is, you need to have that rapport with the patient, particularly with Chiari, because so much of what you guys experience and feel is really subjective. We can't experience, there's no test for a lot of what really troubles you.
I'd just like to clarify something, and I probably didn't say it very well because I get nervous up here, but I'm not defining it as number of surgeries. That's wrong. It's number of patients the Chiari Center, Chiari expert sees or treats. It doesn't necessarily mean surgeries, which a lot of people think that's the case, and that's one of our downfalls.
Barbara, thanks for bringing that up, your question, because we did just discuss that on a board of directors call, I think it was 2 months ago. And there's a multitude of issues that are related to, that came up in the discussion, legal exposure, who sets the criteria, they're a whole plethora of different issues, but it is something that is actively being discussed. It's something that is, to Barbara's point, it's something that's needed. Dr. Hager brought it up, and I'm glad, and again, you played right into his hand by bringing that question up, because that was his whole idea for this panel, was to kind of get a perspective from many different perspectives on what you're looking for in treatment, and from a doctor, from a Chiari center, from a patient perspective, which I'm going to now transition over to this young man, because he has a list that he and his mom put together of what they're looking for in a Chiari center.
Yeah, I got a little bit excited earlier. I'm sorry. Kind of forgot the most important part. Yeah, my mom likes lists too. I don't. She's a nurse practitioner, so she's the organized one, and I'm the slob. So.
You're artistic.
Artistic, that's a good one. He's being nice. So, a pain management doctor or nurse practitioner, a neurosurgeon, a neurologist, a physical therapist, and this one I really recommend, and that is a massage therapist that specializes in MFR, which I'm surprised that a lot of people don't even know what that is. Well, I wouldn't have, but it's a myofascial release, and it's trained by John Barnes in Sedona, Arizona, which is a freaking amazing place. You should go. And it's called Therapy on the Rocks, so myofascial release. Another one is a counselor or psychologist, so important. Someone to talk to who understands and is supportive, because not everyone is lucky like a lot of us in here who has support. Think about the people who are alone. That's gotta suck. So this would be great. Possible group sessions for support. I did my first one the other day, just being with you, and that was wonderful. It was my first one. I didn't want to go, but it was awesome. Family support groups, acupuncturists, yoga classes, Pilates, Tai Chi, and fitness instructors that know about these problems, because you can't just go see any personal trainer. I'm a personal trainer. I would have no idea what to do. I'd be scared. So that's the list. Hope that helps.
I just want to add to his list, actually. I was checking off because I have a list too. So I had everything. I had everything you had.
I forgot the weed dispensary. I'm sorry.
That wasn't on my list. Definitely the physical therapy. I didn't really realize that there are physical therapists who specialize in neurological issues. I actually did go through that for some of my vestibular issues, and it's helped a lot. I'm a lot more balanced than I used to be. But I think one of the things that I do with the kids, because I did used to run the kids program up until 2 years ago, was we also did art and music therapy. I think there's some good alternative therapies that you could add to a center. And then I don't know if you said nutritionist, but I there's so many foods that we eat that flare up and causes inflammation and pain. But I think it would be good to have a nutritionist come and talk to us about our diets and what we eat and what we can remove from our diets to help. So those are my additions.
Well, I just wanted to add, it's very hard to, as we all said, to find a doctor. It took me many years, 14, 17, I can't even remember. It's been so long. But the hardest part for me was insurance. So no matter who we find and who we want to go to, it's, oh, do you accept the insurance? And if you do accept it, are you in our group? And if you're not in our group, we have to come up with something in between to go with that. And then we have to get there. And if we can't get there, and if we have no insurance, well, then where does all that come from? And it's great to have all these lists that we want to go to, but how do we afford it? It's hard. So then we have so many working parts to do this that we have to go ahead and try to find the right person, the right fit, the right place, and the right insurance to cover all of it. So it's as you said, an uphill battle. So, I give kudos to everybody who is here and helping us, and I thank all of you, every single one of you, everybody in the room, just for being here. So, thank you.
There is actually a thing that very few patients know about. It's called a gap waiver, and your insurance companies have a certain mileage distance around you in which if a provider does not or will not accept you as a patient for neurosurgery or neurology or whatever it may be, they are, I believe it's legally bound to do a gap waiver. That's how I had my last 2 surgeries, was through a gap waiver, because I have an HMO that's based in my state and my surgeon's in a completely different state. So gap waivers are something that you can Google and look at. There's some very good resources online on how to get gap waivers. They're not always perfect, but they do help. But yes, insurance is a huge, huge issue for many of us, especially with the current insurance climate and what is going on. For many of us, how do you get insurance? How do you afford it? I mean, a lot of us can't work. How do you afford it? And how do you get it while you're applying for disability and trying to figure out, well, you look like a perfectly healthy person. Why do you, so you run into some of those battles. But yeah, finding a center or a set of doctors with these lists, which are both really, really good, by the way, is a challenge.
So thank you for pushing us. I think that's what y'all are doing, and it's really, is this on? It's really very appreciated. So sometime back we started a few of us started looking at an international Chiari network. It's not a support group. It would be identifying neurosurgeons, not just in the U.S., but throughout the country, that would be this referral network that you obviously need and are obviously looking for. The stumbling block, which can guide us into how to get there, is that we hadn't built the structures that were needed. Basically, then, this would be a self-identified network. It would be, do you do Chiari? How many do you do? If you don't measure how they do and know what they do, should they be in the network? So that raised a number of questions, and I will say that there are some answers coming from the separate Chiari groups. They are coming. What I'd like you guys to push back on is we need the various Chiari organizations to begin to network amongst themselves and share these building blocks that are being created. What are the building blocks? Well, number one, common data elements. Are we all talking about the same thing? If we don't agree about the word that we use to describe something, we can't really talk about, compare, do research. Number two is outcome data. I had a spontaneous outburst at Concord Chiari about 7 years ago, and somebody was presenting about their surgical technique. I had a different opinion, and I just blurted out, the problem is we don't have a Chiari-specific outcome scale. You've heard of the Karnofsky, you've heard of that scale, you've heard of that scale. How are we going to know how we compare? Is your technique better than not if everybody's using different scales? And after the meeting, 2 outcome scales were generated. My shop went to work, but Dr. Frim got out the gate first at the university in Chicago, and they have the Chicago outcome scale. We developed the Chiari outcome scale, Chiari symptom profile specifically. Sooner or later, we're going to have to pick 1 or 2 of these outcome scales and encourage anyone who treats Chiari to collect their data with the same tool. So, so these are some of the building blocks. And then again, I'll close with what I thought. If we're having common data elements directed by or created by one institute, one Chiari group, this great physician-patient interaction by this group, other groups contributing, et cetera. We've got to put that power together. We're not going to break through one organization at a time. We've got to figure out how to begin to come together. I am hopeful that we are going to begin to look at the nitty-gritty of this problem. And actually, this conference has been great for that. We've seen data. The more data that we see, the more we can empower other new neurosurgeons. So eventually, we want somewhat of a turnkey solution for the young new neurosurgeon to say, here's what we know today. Build on it, grow on it, et cetera. Maybe I can blurt out like this because I'm sort of a boomer and getting into that phase. It's going to be up to the younger folks, mid-career folks, to bring this on. I think we'll get there. The final thing that I tell to my patients, and the frustration is, if any of you want a knee replacement, myself included, let's say we want, you're going to go to a knee specialist. 15 years ago, you might be sent to the local orthopedist because they'll, well, go there. Nowadays, you know that you've got the power to search out a knee place, right? You're not going to be treated by someone that does a little of this, a little of that, a few needs a year. Chiari is that kind of disorder. We need to grow up centers nationally throughout, and we're exploring how to help that process. We can't do it on our own, and maybe we need to collaborate more, but we need 8 or 10 solid centers nationally where you go online, you pick the center that's closest to you or the one you want to go and travel. We're not there, but it's a challenge to the younger group to carry this forward.
Any more questions? Okay.
Not a question, but maybe a comment. Just trying to listen to what everyone is saying and some of the concerns from the family members and the concerns over difficulties with insurance and travel. There might be a mechanism through ASAP or some of the other organizations or some kind of third party where we could offer simple opinions on radiographs, on where do I go, what do I need to do, is this something that I need to travel for? I think sometimes there's a real simple question at the very beginning that may seem like a very daunting process before you need to go and get on a plane and spend a week somewhere and get surgery and get invasive testing done. There are plenty of websites that exist in the neurosurgical and other medical communities where patients share images, where doctors share tough cases, and we say, this is an interesting case, what would you do? And this is something we do in the neuro-oncology community as well. So there might be a resource that we can marshal together with these groups, and maybe ASAP can take the lead, maybe it's something for further discussion on the board of directors level, but send in your films, we'll get it to one of our panel of scientific advisors, and they'll get you a response back. It may not be the same thing as going to a doctor, but at least it could get the ball rolling for people who can't afford it or have insurance problems in the meantime, so they can at least feel like they're getting into the system and seeing something positive from someone who knows what they're talking about.
Thank you. Any other questions? Wonderful. Well, that breaks for today. Appreciate everybody being here, sticking around. Thank you, panel. And thank you, doctors, for the questions. See you tomorrow.